Good afternoon, my fellow Americans. I have to tell you that this Ebola crisis is not really anything that you have to worry about. Michelle and I have done all kinds of work, and we are taking care of it. So do not fret it. It only took us 3 weeks to send all the patients to level 4, and Dr. Tom Frieden is on top of this, and he's gonna score points. And I also have the Secret Service that protects me in the White House, so you don't have to worry about a lack of leadership here. We are investigating the Buckeye Boys because we think they may be the main cause of this, because they're eating NT8's pumpkin pies and various other and sundries from his girlfriend in Ohio.
The Center for Disease Control for welcoming me here today. Tom and his team just gave me an update on the Ebola outbreak in West Africa. Our efforts to help mobilize the international community to fight it, and the steps that we're taking to keep people here at home safe. Tom and his team are doing outstanding work, and between the specialists they have on the ground in West Africa and here at headquarters, they've got hundreds of professionals who are working tirelessly on this issue. This is the largest international response in the history of the CDC. After this, I'll be meeting with some of these men and women, including some who recently returned from the front lines of the outbreak, and they represent public service at its very best. And so I just want them to know how much the American people appreciate them. Many of them are serving far away from home, away from their families. They are doing heroic work and serving in some unbelievably challenging conditions, working through exhaustion day and night, and many have volunteered to go back. So we are very, very proud of them. Their work and our efforts across the government is an example of what happens when America leads in confronting some major global challenges. Faced with this outbreak, the world is looking to us, the United States, and it's a responsibility that we embrace. We're prepared to take leadership on this, to provide the kinds of capabilities that only America has, and to mobilize the world in ways that only America can do.
And Mr. President, you look so awesome.
That's what we're doing as we speak. First and foremost, I want the American people to know that our experts here at the CDC and across our government agree that the chances of an Ebola outbreak here in the United States are extremely low.
You can tell by my looks now.
We've been taking the necessary precautions, including working with countries in West Africa to increase screening at airports so that someone with the virus doesn't get on a plane for the United States.
I just wish my Secret Service could keep these fucking peckerheads off my ass.
In the unlikely event that someone with Ebola does reach our shores, we've taken new measures so that we're prepared here at home. We're working to help flight crews identify people who are sick, and more labs across our country now have the capacity to quickly test for the virus. We're working with hospitals to make sure that they are prepared and to ensure that our doctors, our nurses, and our medical staff are trained, are ready, and are able to deal with a possible case safely.
How'd that work out for you there, Barack?
And here I've got to commend everybody at Emory University Hospital. I just had the opportunity to meet with Doctors Gardland and Bridner and members of their team, and the nurses who, sorry doctors, but haven't been in hospitals. I know they're the ones really doing the work.
And he hugged and kissed the girls. What a stud.
And I had a chance to thank them for their extraordinary efforts in helping to provide care for the first Americans who recently contracted the disease in Africa. The first 2 of those patients were released last month and continue to improve. And it's a reminder for the American people that should any cases appear in the United States, we have world-class facilities and professionals ready to respond, and we have effective surveillance mechanisms in place.